Very troubling discovery about this new virus. We're learning so much about it. It's the virus, of course, that is overwhelming the nation. Doctors are now discovering blood clots. Blood clots leading to strokes in an unusual number of relatively young COVID-19 patients, people in their 30s and 40s. Researchers have identified about a dozen cases in New York City and in Philadelphia, people normally at very low risk for strokes. Joining us now, a doctor who has been studying this development very closely, Dr. Pascal Jabbour. He's the chief of the Division of Neurovascular Surgery at the Vicki and Jack Farber Institute for Neuroscience at Jefferson Health in Philadelphia. Dr. Jabbour, thanks for joining us. What explains the blood clots? How does COVID-19 affect the clotting mechanism?
Hi, Andrea. Thank you for having me. As you know, the virus causes an inflammation, and there are multiple theories, but we think that this inflammation, there's a protein that increases in the blood, and this can trigger the formation of clots.
And when it triggers a formation of a clot, how do these patients present? Is it something where you see this immediately, you can test for it? How can you, I guess, diagnose it before it becomes a stroke?
Practically, those were a small number of patients. It was a snapshot between March 20th and April 10th. So too early to draw conclusions, but I think concerning enough to raise awareness. So what happened is we noticed that there's a high number of young patients and middle-aged patients presenting with stroke, and they are COVID positive. And those patients, 50% of them did not have any risk factors for stroke. And in some of them, stroke was the first symptom of their COVID. So unfortunately, you can't test for that, for the clot, until someone is symptomatic. Until someone develops symptoms. So we also noticed that a lot of patients are delaying in presenting to the hospital because they are scared because of the pandemic. That's why the message out there is